Welcome to Medical Licentiate Emerson channel. Today we are learning QUINSY. It sounds like an old-fashioned ailment, something you'd read about in a historical novel. But trust me, it's a real and potentially serious condition that we still see today. Imagine a severe sore throat so painful it's hard to swallow even your own saliva. Now picture that pain radiating to your ear and jaw, making it difficult to even open your mouth. That's the reality of QUINSY, also known as a peritonsilar abscess. In simple terms, QUINSY is a collection of pus that forms near your tonsils, deep within the tissues of your throat. It's not just a bad sore throat, it's an infection that needs prompt medical attention. You might be thinking, wait, doesn't everyone get a sore throat now and then? Yes, but QUINSY is different. It's not your typical viral sore throat that goes away with some rest and fluids. QUINSY is a bacterial infection, often developing as a complication of tonsillitis, which is an inflammation of the tonsils. So, how does this happen? Well, when you have tonsillitis, your tonsils, those two small lumps at the back of your throat, become inflamed and sometimes develop small pockets of pus. In some cases, these pockets can expand and merge, forming a larger collection of pus, the dreaded peritonsilar abscess, QUINSY. Like any good detective story, we need to identify the culprits. In the case of QUINSY, the usual suspects are bacteria, often a combination of different types. The most common culprits are Streptococcus pyogenes, also known as Group A Streptococcus, and Staphylococcus aureus. These bacteria are notorious for causing various infections, and when they find their way to the vulnerable tissues around your tonsils, they can cause a real ruckus. Now let's talk about how to spot QUINSY. It's crucial to recognize the signs and symptoms early on because delaying treatment can lead to complications. The most common symptom is a severe sore throat, often worse on one side. This pain can be so intense that it makes swallowing incredibly difficult. In fact, some people with QUINSY drool because it's too painful to swallow their saliva. Along with the excruciating sore throat, other symptoms can include fever and chills, muffled voice, often described as hot potato voice, swollen lymph nodes in the neck, ear pain on the affected side, and bad breath. Section 5. Red flags. When to suspect QUINSY. While a severe sore throat is a hallmark of QUINSY, certain signs should raise your suspicion and prompt immediate medical attention. These red flags indicate that the infection might be progressing and require urgent care. One such red flag is difficulty opening the mouth, also known as trismus. The swelling and inflammation in the peritonsillar area can become so severe that it restricts jaw movement, making it difficult to open the mouth wide enough to eat, speak, or even breathe properly. Another red flag is a visibly swollen tonsil, often pushing the uvula, which is the small, teardrop-shaped tissue hanging at the back of the throat, towards the opposite side. This asymmetry in the throat is a strong indicator of a potential peritonsilar abscess. Section 6. QUINSY diagnosis. More than just a glance. Diagnosing QUINSY involves a combination of a thorough medical history, physical examination, and sometimes additional tests. During the physical exam, the doctor will examine the throat carefully, looking for signs of swelling, redness, and asymmetry. They may use a tongue depressor to get a better view of the tonsils and surrounding tissues. In some cases, imaging tests like a CT scan or ultrasound might be ordered to confirm the diagnosis and determine the size and location of the abscess. Additionally, a needle aspiration, where a thin needle is inserted into the abscess to collect a sample of pus for testing, can help identify the specific bacteria causing the infection. Section 7. Fighting back treatment options for QUINSY. Treating QUINSY typically involves a multi-pronged approach, addressing both the infection and the collection of pus. Antibiotics are the first line of defense against the bacterial infection. These are usually administered intravenously, especially in severe cases, to ensure rapid delivery and effectiveness. In addition to antibiotics, draining the abscess is crucial to relieve pain and prevent the infection from spreading. This can be done through needle aspiration, where a needle is inserted into the abscess to draw out the pus, or through a surgical incision, which allows for a more thorough drainage, especially for larger abscesses. Section 8. Complications. The unwanted guests. While most cases of QUINSY respond well to treatment, complications can arise, especially if the condition is left untreated or if the infection spreads. One potential complication is the spread of infection to nearby tissues, leading to cellulitis, a painful skin infection, or even mediastinitis, a serious infection of the chest cavity. Another rare but life-threatening complication is airway obstruction. The swelling in the throat can become so severe that it blocks the airway, making it difficult or impossible to breathe. Section 9. Prevention is key, keeping quinsy at bay. Preventing quinsy starts with good oral hygiene. Brushing your teeth twice a day, flossing regularly, and using an antibacterial mouthwash can help reduce the number of bacteria in your mouth, lowering the risk of infections. Equally important is seeking prompt treatment for tonsillitis, especially if it's recurrent or severe. Early and appropriate antibiotic treatment for tonsillitis can significantly reduce the likelihood of it progressing to a peritonsilar abscess. Remember, prevention is always better than cure. By taking these preventive measures and seeking medical attention when needed, you can help keep quinsy at bay. Thank you for watching Medical Licentiate Emerson Educational Channel.